Hey beauties, welcome back to my channel. If you're new here, welcome and thank you for being here. My name is Laverson. I am your host and the founding owner of BeyondBody.com. As you can tell, totally different scenery. Right now I am in my vehicle. I just pulled up to the gym, but I remembered I wanted to create some content for you, and I already have my next Let's Ask a Surgeon video prepared for you, but there is no intro. So I needed to do an intro. I didn't want to wait until I made it back home, made it back to my office. So here we are, right here, right now. So if you've been following my whole fitness journey, weight loss, weight gain, surgical procedure journey, you know, the last video that I shared was me introducing Dr. Laverson, finding out who exactly he is, sharing the man behind the scrubs. And so in today's episode of Let's Ask a Surgeon, we're specifically talking about what's the difference between the term plastic and cosmetic surgery. So stay tuned so you can find out. What is the difference? Or maybe there is no difference. It's the term really gets on my nerves. Plastic surgery versus cosmetic surgery. Like, why is it called plastic? What is
Okay.
that?
Well, that's a really good question, and the answer is long, Larissa. I don't know how much time you have, but it's an excellent question because the marketplace is very confusing. Okay, there is only so the American Board of Medical Specialties is like the Federal Reserve for medical training. Okay, every residency program has to get accredited by the American Board of Medical Specialties. And the American Board of Medical Specialties has broken down the entire sphere of medical care into like 23 specialties. Rheumatology, rheumatology is for arthritis and autoimmune. Gastroenterology for the GI tract, liver, biliary, intestines. Neurology and neurosurgery is for the central nervous system and peripheral nervous system. Orthopedic surgery is for musculoskeletal. So there are all these specialties, and there's only one specialty that the American Board of Medical Specialties has a training program accredited in cosmetic surgery, and that's plastic surgery. Plastic surgery, Laurice, encompasses two kinds of surgery. Okay, it encompasses aesthetic surgery or cosmetic and reconstructive surgery. Okay, and actually, those are the same surgeries. It's moving tissue around. It's the name plastic is from the Greek root plastikos, which is to mold or to form. Okay. That's where it came from. Plastic. It's to mold or to form. And why are two different reconstructive and aesthetic surgery? Why two different surgeries in one specialty? The reason is because they're the same. The only thing different are the patients. Okay. Cosmetic patient, the reconstructive patient, let me start with that. Reconstructive has some abnormality, Laurice. They come in with either a trauma, an injury, a laceration. Maybe they had cancer, like skin cancer, and there's a chunk missing where the cancer's out. Or breast cancer, they're missing a breast where they had a mastectomy. Or maybe a child is born with a deformity, some birth defect, okay? These are all what are considered not within the bell curve of what's normal, okay? There's a physical abnormality. that we are charged with fixing to make the patient's quality of life better, to make them feel more normal, look more normal, or function more normally. Okay, if it's a cleft lip or palate, we want to bring that lip together. That is reconstructive surgery, taking the abnormal, making it normal. Aesthetic surgery is the same thing, moving tissue around, but the patient starts out normal, Laurice. I mean, if you don't mind me telling the audience, when you came for your tummy tuck, you were normal. It was just postpartum. But there was nothing abnormal. That's what normally happens after pregnancy. The skin stretches out, the belly gets, stretched out, and the skin sags. There's stretch marks. Same thing after nursing. The breasts sag a little. It's normal, but you may not like the way it looks. So we incorporate the same techniques in aesthetic surgery as reconstructive surgery, and that's plastic surgery. The mastery of those techniques and management of these problems for both the aesthetic and the reconstructive patient. So what's cosmetic surgery? There is no American Board of Medical Specialties recognized specialty of cosmetic surgery. It's within plastic surgery. That's the accredited training program. Many surgeons call themselves cosmetic surgeons because they may have trained in, for example, ear, nose, and throat surgery, and they know something about skin cancer and reconstructive. They know about the ears. They trained in, diseases of the larynx, the voice, the oral cavity, the nose, the sinuses, and it's awfully close to the face. And they do some training in it, but they don't really, it's not in their DNA of their training to learn the fundamentals of aesthetic and reconstructive surgery. That's all. So they'll call themselves cosmetic surgeons, but their ABMS, American Board of Medical Specialties certification is maybe in ear, nose, and throat, otorhinolaryngology. There's even dermatologists who practice dermatologic surgery or dermatologic cosmetic surgery. They may be Mohs surgeons reconstructing skin cancers. They know something about it. I'm not going to dispute that, but they don't really have the kind of broad fundamental training that the plastic surgeon has. I mean, before I did plastic surgery, I had to become a fully trained general surgeon, do my chief residency in general surgery. And that just develops in you, Laurice, a depth of understanding, a comprehensiveness of training in surgery that is hard to replace. Okay. And Laurice, I wanted to be the kind of doctor that I would want to go to myself if I were a patient. So I said, you know what? I have to have those high standards, and I just got to put my life on hold. If this is what I want to do, it's like these athletes tell you, and Mike Tyson, I heard him the other day on Instagram. He's there saying, look, discipline is when you do something you don't want to do like you want to do it. Okay. Yeah. If you want to walk the walk, if you want to talk the talk, you got to walk the walk. And that's it. There's no substitute, these guys that are great players, they're in the gym, Kobe Bryant, he's there in the gym when everybody else is out there, getting partying and living life up. Yeah. And they're all great players and everything, but what elevates you to the next level is that's all. So I feel like if your audience is interested in this kind of procedure, you want to get a board certified plastic surgeon, American Board of, not just board certified. Okay. I think certified by the American Board of Plastic Surgery. And the reason is because these are surgeons who have the highest standards for their own performance. And if they have the highest standards for their own performance, the chances are, Laurice, that surgeon is going to have higher standards for your result.
Yes.
Okay? And that's what you want.
Yes.
No shortcuts.
Yeah, no, definitely not with somebody's life. You want to go the good route.
Not even with your belly button.
Look, belly buttons are such a big deal. We already went over that.
All right.
Well, thank you so much. Thank you for your time, Dr. Laverson.
Thank you, Laurice. Thank you for what you're doing. I love it. I appreciate it very much. Thank you.
I appreciate you. I'll see you next time, Dr. Laverson.
All right. Thank you, Laurice.
All right. So now you know why they call it plastic or cosmetic surgery. If you were stumped like me and never knew exactly why those terms were used, hopefully this video helped clear some of the air for you. I know it did for me, because I was confused. I'm like, nothing on me is plastic. Like, why is it called this? But Dr. Laverson absolutely broke it down and made it understandable for me. So hopefully you got some more insight as to plastic surgery, cosmetic surgery. And if this is something that you like, or if there's topics that you'd like to see on the next Lex Ask a Surgeon, make sure you drop them down in the comment section below, because I do go through my comments and I read them, and I am always open for suggestions. And, you know, I'm able to meet with Dr. Laverson and have these types of discussions. So if you're curious and there's something you want to know, please don't be shy. Ask me. So again, if this is something that you like watching, make sure you like, share, and subscribe to my YouTube channel, and make sure you hit that bell notification so every time I do upload a new video, you will be notified. I'll see you on the next one. Bye.